You're going right now. So a very good afternoon, and thank you so much for joining us. Today's conversation is going to be a very relevant and very informative content, especially considering today's time. Uh, so far, we know that we've all been safely tucked inside our houses, uh, staying away from COVID-19. But things are definitely, life cannot go on like this. And we don't know when the vaccine is going to come out. So considering all that, and with the lockdown getting relaxed, I think we have to see how to prepare ourselves. It is almost uh, we have to let our helpers in, and there are a lot of us who are going back to work. So there are so many things happening now in this situation. How do we take care of ourselves? How do we protect our loved ones? To answer all these questions, I have just the right person. Thank you so much, Dr. Ashutosh Shukla, for joining us today. Dr. Ashutosh is an infectious disease expert. He's also the director and head of Department of Medicine, Artemis Hospital, co-founder and medical director, Prana Center for Integrative Medicine. And as a fellow of the American College of Physicians, he is trained at Stanford Medical School and San Francisco General Hospital for advanced training in infectious diseases. So doctor, this is fabulous. You're just the right person to answer away all the questions that we have in our head. We have our members who've also joined in. Members, request you to keep posting your questions in the comment section. We will have doctor answering, but before, yes, doctor, so we will wait for you to now tell us more about the situation that we are in and what are the right things that we should be doing.
Good afternoon, Neela, and thank you so much for inviting me on this platform. It's an honor and pleasure to be speaking about such a relevant topic like as of today. So the topic for discussion is COVID-19. Are we looking at the next normal? So the way we are going to progress in today's discussion is that, first I will probably talk a little bit about the disease progression and the viral monitoring, because it is important for us to understand how the epidemiologists view this disease. In the sense, we should know how the disease will evolve, what will happen next, where are we heading. And then I'll talk a little precautions outside the house, precautions inside the house. And we, by nature, are provided with an immune system. And we need to boost that immune system so that we can fight this infection. And lastly, the $1 million question, when will this COVID-19 pandemic end and how will it end? So let's see where we go.
That's the $1 million question, which is there in all of our heads, doctor. We are eagerly waiting to hear more from you now.
Right. So let me just quickly share a presentation with you. So, just a little bit about the introduction. This particular disease, the pandemic COVID-19, is a little different in the sense that unlike the flu, there is no treatment or confirmed treatment, so to say, and no vaccine as yet available. And the knowledge about this virus is evolving slowly. So we are still at a stage where we don't know everything about this virus. luckily, all these patients that we have seen so far in the hospitals and in the outpatient wards, 85% of them are mild to moderate severity, and they gradually resolve and they don't land up with complications. Um, Initially, it was thought that mostly it is fever and cough, but now gradually we are getting to know that it has so many other manifestations. It can manifest with kidney problems, cytokine storm, which is an immune system response, lung problems, coagulation abnormality like a DIC. So now the learnings and the knowledge about the disease has evolved, and we know much more about COVID-19 now compared to what we knew 3 months ago. And the bare fact remains that it is a disease which hits the elderly and those who have an underlying condition like maybe a lung disease or diabetes, heart disease, or some other associated disease, or those who are taking some medicine which suppresses their immune system like steroids or maybe anti-cancer drugs or something like that. So these are the subset of people who have to be really extra careful. So to understand how we are heading and where we are going, I think a little comment about disease progression. Most of the epidemiologists use certain indicators or parameters how we monitor the disease. We go mostly by the case doubling rate, which means within how many days the number of cases in a particular community doubles. So in India, before lockdown, it was doubling in 3 to 4 days. Now, luckily, it's around 11 days. So the lockdown has helped in controlling the transmission of the disease. Then the other parameter to assess the progress of the disease is when we are doing these testing, the nasal and the throat swab test, how many of the 100 people that we test come out positive. So in India, this is luckily 4.4%. So we are not that bad. And unlike countries like UK or Belgium, where the mortality was very high, here in India, the mortality ratio is 3.2%. Like, in today's latest figures, 2,500 people in India have died of COVID-19, and there are 78,000 people who are infected with COVID-19. And luckily, the recovery rate is in India is about 25.19%, which is fairly good compared to the other countries which are having 30%. So in COVID-19, it is important to have a detailed contact tracing in the sense, right now what we are doing is we are trying to curb the infection in the sense, find out where the active cases are, tracking them and isolating them so that they don't spread the infection to others. So that is the key of the infection control. Right now, the test which we are doing is an RT-PCR test. It's a genetic test wherein we stick a swab stick on the back of the nose and the back of the throat, and with a sterile technique, it is sent to the lab. In 24 hours, we get to know whether the patient is positive or negative. But here we have some good news. CSIR, our own organization, has done some research, and is within 4 weeks it will come out with a blood test which will detect this antibodies within 1 hour of testing. But the problem with that test is that in COVID-19 it takes some time for the antibodies to generate in the healthy body. So it's this kind of a throat swab testing for direct detection of the virus is going to be the gold standard of treatment unless we come out with a better test. And right now in India, there are about 350 labs which are doing this test. And there are certain pockets in the country which are more infected and the disease is progressing rampantly, especially Mumbai, Ahmedabad, Pune, Agra, Kolkata, Delhi. Luckily, Gurgaon, we are in orange zone, and the government is aggressively trying to get it into the green zone. We don't want Gurgaon to go into the red zone. So that's critically important. And that's why the approach for the disease control is segmental, in the sense the government is trying to target those areas which are hotspots. Because India is such a big country, 8 cities altogether contribute about 50% of the cases. And luckily, there are 250 districts in the country which have no reported cases at all. So the strategy has to be segmental, in the sense where you have more disease, you try and control the infection more. Then coming on to, now that we've talked a little bit about the disease progression, let's understand how do we prevent, and what are the precautions we should take. Firstly, outside the home, and then inside the house. Outside the house, of course, wearing face mask, maintaining social distance, avoid touching commonly held objects, lift buttons, use the elbow, don't, we have the habit of covering our cough and sneeze with the hands, bare hands. That's the wrong practice. If at all you have to cough and sneeze into tissue paper, and then, or you cough and sneeze into the upper sleeves to avoid spread of infection, if at all there's an asymptomatic infection sitting there. So what do we do inside the house? That is a critical question. When there are certain simple steps which you have to take. The basic mantra is be guided by science, don't be guided by fear. So we should take simple steps to be careful of what precautions need to be taken. Keep your bags and packets at the entry and sanitize them before you take out the contents, and preferably leave your shoes outside the house before entry. If you want to sanitize and clean your vegetables and fruits, take a solution of white vinegar and water, solution of 1:4 ratio, and clean and disinfect all the highly infected hotspots. The commonly held objects like the door handles, the telephone handsets, etc. These are the things which you touch more often. So there are these wipes and sprays which are available, and they have these labels on them as to how long the wipe should be, the chemical should be kept there. When you wipe it, it says, leave it for 1 minute or 2 minutes, depending upon. So you can use one wipe at a time and clean multiple surfaces, but as long as that wipe is wet, it's fine. The moment it dries, then don't use it. Use a fresh one, and don't use the same wipe for a different room. Keep a different wipe for a different room. And most of these hand sanitizers and these surface sanitizers say that they kill 99.9% of the germs. So try and read the label. If you don't want to go for that, maybe you can use a soapy water solution. But scrubbing the surfaces hard with the soapy solution is important to wipe off the germs and kill the infection. So now that we've talked about the precautions and preventions to be taken as far as the household objects are concerned, there are certain bleach solutions which you can prepare. Take maybe 5 tablespoons of bleach and mix it in 4 liters of water, and disinfect this surfaces. But this solution should not be used for more than 24 hours. As far as electronic items are concerned, your cell phone, etc., any hand sanitizer which has 70% alcohol would be good enough. Now that we've spoken a little bit about the preventions and precautions, now we will move on to immunity and self-care. Self-care is important because we all have an immune system which is meant to fight outside infections, and there are various things which are available, especially in alternative medicine, which boost our immunity, and these are very helpful. Sleep, exercise, meditation, yoga, everything, all these add to your immunity. So I think it's important to make sure that you are having adequate amount of sleep, you are exercising regularly, you are doing some amount of yoga or meditation, all these things add to boost your immunity.
So thank you so much, Doctor, for giving us the facts and also for reminding us that we should be guided by science and not by fear. So that was very informative. So some of the questions that come to our head is, one is we see that there is an increase in the number of asymptomatic cases, which so if I were to go out to work, if I have to do that, and if life comes back to normal and if we have to go out, then in that case, what is the precaution that I should take, or if a loved one is going out, then what should I be ensuring that about their safety?
So, unlike other diseases, in COVID-19, there's an incubation period in the sense that once the infection comes into a person, it takes about 14 days, or average of about 5 days, but upper limit of 14 days for the symptoms to start. But for those initial 10 to 14 days, he is infectious to others. And there's a study by a Dutch and a Belgium researcher wherein they identified two clusters in Singapore and China, and they found that about 48 to 66% of the 91 people that they studied in Singapore, they had contracted the infection from someone who was pre-symptomatic before even getting the infection. And there's another study wherein about 62 to 77% of the 135 people that they studied, they found that the coronavirus infection came into people who were before the disease.
Okay.
So it is critically important to practice washing of hands frequently. Whenever you go out, wear a face mask and do not share your personal items and maintain social distance of at least 6 feet from others so that you don't get the infection. So
Okay,
these
so
are
that brings another question. Like when we go on an elevator, so does this come through air as well, or is it only through contact? And is it safe to go to use an elevator, sharing that space with another person?
So, when a person who's actually having the COVID-19 infection, when he coughs or sneezes, the particles the virus stays in the air, aerosol, about 3 hours. And on hard surfaces, it lasts for about a couple of days.
Hmm.
So, it is always advisable not to touch the elevator buttons. Maybe use your elbow. Why? Because from your finger, it can come into your body the moment you touch the face, eyes, and nose. So avoid using your fingers for lifting any commonly held object.
Okay.
But that's why they say that, wear a face mask when you're outside because you don't know the other person whether he's infected or whether he's having a disease.
So there is a lot of confusion around this face mask also. Now we see a lot of times when they talk about COVID and face mask, they say face mask is to protect people who are around you.
Right.
But will face mask also help to protect myself when I'm wearing it?
Yes, I mean, it does help one, because you are avoiding touching your face and nose. Hence, you don't transmit the infection inside. And besides coughing and sneezing, you are not transmitting the infection. Uh, so it is important to wear the face mask, I think.
It is important, yeah, for sure. So another question is you also touched upon surfaces, doctor. So the different surfaces have different times until when the COVID can be active on it. So is there any material that is safe and where uh, we do keep receiving a lot of these forwards, though we delete it, somewhere it is stuck in the head. But we do see that some of the materials, like they say, copper cannot, the virus cannot stay on copper for too long and things like that.
Mm.
What is your take on that, doctor?
So there's a study in Science Direct which was quoted in NEGM, wherein they found that on copper, the virus survives only for about 3 hours, whereas on stainless steel, it survives for 3 days, 3 to 4 days. On plastics, it survives for 4 days. On cardboard surfaces, it survives for 24 hours.
Okay.
So it may be a better idea to use a copper utensil, because, but then, if you are washing utensils at home and if you are using soap, because soap kills the bugs and the viruses.
Yeah.
So even stainless steel things are fine, but if you are going out, maybe you can use your own copper utensil, uh, which will not carry the virus for more than 2 to 3 hours. That is a safer bet.
So another sensitive topic in our community is about allowing the helpers inside our houses.
Oh, yes.
So now, if we wish to bring our part-time helper inside our house,
Right.
what is your advice on that?
So, first of all, you must talk to the RWA, the Resident Welfare Organization, because they keep getting directives from the government. So, what is their what orders do they have?
Hmm.
However, whenever these people are allowed, you should make sure of 5 or 6 things. The person who's coming in, give him a fresh mask, because you don't know the face mask which he's wearing is dampened and ineffective. Maybe have a small little hand sanitizer at the door. Uh, Ask him to clean the hands and make him leave the shoes outside before entering your house. If you want to take extra precautions, give him a face, the surgical cap,
Mhm.
uh, so that, because hair are a common source of transmission of infection, and ask them to leave their bag or mobile phone outside. So there should be some kind of a desk or table or something just outside where they can leave these things, and where the hand sanitizer is kept and a mask is kept. Just ask them to don these things and then come in.
Okay, thank you, Papa. So as the temperatures are going up, I
Right.
still know a lot of people have preferred not to switch on their air conditioners because of this fear. Now, please tell us, is it okay to switch on the air conditioner or is it not safe?
Yeah, so it is safe to switch on the air conditioners. The temperature should be a little on the warmer side. The recommended temperature, they say, is 24 to 30 degrees. Because, if you keep it 22 or less than that, the virus tends to propagate. But then one should also make sure that intermittently you ventilate the room.
Hmm.
uh, all the time AC running and enclosed space, no ventilation from outside, that's not a good idea. Maybe if there's a washroom nearby, for a little while, switch on the exhaust, uh, open the window, let the air cross. So that helps. And secondly, the filter of the AC, that normally if you are cleaning, say about once a week, should clean it twice a week.
Okay.
Uh, and the humidity, that also should be, the temperature, the humidity of the room should be around 40 to 60%.
Mhm. And also, we've been receiving this question in the community. A lot of people who are in pain, but they are still staying at home because the fear of going to hospitals. Is it safe to go to hospitals around this time, doctor?
Yes, there are some situations for some people where, going to the hospital becomes a necessity.
Yeah.
um, so I would suggest that, in such situations you should ensure that the mask which you are wearing is a better quality mask. Maybe you can use a N95 mask instead of the normal cloth or the medical mask. Carry a hand sanitizer bottle with you. Maintain a distance of 6 feet from others, and don't touch the railings or the door handles in the hospital. And when you come back home, keep your shoes outside, leave your bag outside, sanitize the bag, have head wash immediately, and put your clothes into the washing machine with warm water in it.
So, yes, so from the, just to reiterate, because when you started, I could sense that what you meant is unless extremely necessary, do not step out to go to the hospital. But when we go to the hospital, these are the measures that we can take to protect ourselves.
In our hospital also, we are trying to discourage relatives. Visiting hours have been curtailed. Only if it is necessary, you come with a relative, but try and come all alone if possible. So the less the number of people, the better.
Meenakshi Rajagopalan has asked, my child is asthmatic. What are the precautions I need to take? For now, we are homebound.
Sorry, your child, I could
The child is asthmatic. The child
asthmatic.
has asthma, yeah. And what are the precautions I need to take? For now, we are homebound.
So, simple hygiene precautions, um, hand washing. If the child is going out, uh, distancing, social distancing, uh, enhanced immunity status of the child, adequate sleep. So these are the standard guidelines which are. One should not panic and one should not fall trap to fear, because what happens is, fear tends to suppress our common sense and logic, and one should be guided by understand how the virus spreads, go to the basics. Once you understand the science, you go by those guidelines and don't be guided by fear. Don't let fear be so prominent in your mind.
Doctor, in the same context, a lot of people are talking about steaming every day, taking steaming every day. Is that a good thing? Or do you recommend it?
Uh, Not, I mean, there are no evidence in the literature for that. As such, steaming does help to clear up the sinuses, and as such, it is a good thing to do. But specifically for coronavirus, there's no evidence as such that it kills the virus.
Got it. Okay. Now, Chitra Sharma has asked, there are many blood requirements every day, but people are scared, including me, to go to the hospital. Please advise any other option where someone can donate blood. Uh, she wants to donate blood,
Okay.
but she's scared to go to the hospital to donate blood. So she wants to know if there's any other way she can reach out to donate blood. Uh, so probably we can find out the information later and post it.
I think we can post it in our site. Yeah.
Yeah, but doctor, if somebody wants to give blood, and if the hospitals are asking, because we also keep posting in the community about blood requirements, is there a need for the fear, or how does one go about it?
So, this particular disease, COVID-19, is spread by respiratory droplets. It has nothing to do with blood transmission. So, you need not be scared. As long as you are taking the standard hygiene precautions which have been recommended by WHO, CDC, I think you're fine. You can go ahead and donate blood. There's no problem.
And should we? So Rasika Narayan is asking, should we take multivitamins to boost our immunity besides eating as healthy as we can?
What I would suggest is that if you are eating a balanced, nutritious diet, loading yourself with multivitamins is not logical, unless you have some disease like maybe celiac disease or a malabsorption syndrome, which is hampering your absorption of nutrients and vitamins. That may, uh, in those situations, definitely you need to take a multivitamin. Or if you take alcohol on a regular basis, or suppose you are above, say, above 50, 55 years of age, then definitely you need to take a multivitamin, but not otherwise. I mean, if a balanced, good, nutritious diet is good enough, it has all the vitamins and minerals in it.
Doctor, we also see that Kerala has contained this beautifully, and the number
Right.
they've controlled it very well. So, what is your take on this? Do you think we have anything to learn from them? And
Yes.
my last question on this is, what is your take on alternate medicine?
So, Kerala and Goa, both the states have done very well. Um, they were very aggressive in the very initial stages. If you remember, when the few students from Wuhan came into Kerala, that time itself they had aggressively contained those students. They have uh, tracked the cases. They have done it very scientifically, um, and they have not allowed the spread of the disease, and that is the way to go. Similarly, outside India, also, we have to learn from countries like Taiwan, Korea, where aggressive and early testing and case tracking and isolation of those cases. These are the three mantras of controlling COVID-19. Uh, I mean, it's a question of being responsible. As citizens, we have to be responsible citizens. We have to go by the guidelines which have been recommended by WHO and Ministry of Health. Uh, take all the precautions, hand hygiene, face mask, social distancing, and avoid touching, and that should be fine. So all of us are playing a role in that sense. We are also, each and every one of us is playing a role in preventing transmission of the disease. So we have to do it responsibly.
And your take on alternate medicine, doctor?
Yes, alternate medicine. Yes, uh, I mean, see, one is preventing COVID from contracting COVID. The other is treating COVID. Well, as far as preventing COVID is concerned, definitely alternative medicine has a big role. In fact, at Prana Center for Integrative Medicine, that's what we are trying to do. We are trying to integrate allopathy with alternative systems. But unfortunately, for treating uh, the disease, there's no such evidence, but there are trials going on, remdesivir, etc. These are the other drugs which have been used. But for preventing COVID, there's a big role for alternative things to boost your immunity. And these things don't come suddenly overnight. You have to keep practicing these things over every day. I mean, things like, drinking warm water throughout the day, practicing yoga, meditation 30 minutes every day, increasing intake of spices or, jeera, dhania, lehsun. These are the things which boost your immunity. They say that even prash, but here I would say that if for those people who are diabetics, make sure that the prash is sugar free, because normally there's a lot of sugar in prash. Then, herbal tree, the tulsi, dalchini, all these things, dry ginger. Then, of course, golden milk, lukewarm milk with 150 ml of milk and about say 100, say about half a teaspoon of haldi every day. Then there are these things, like applying some coconut oil into the nostrils, because that forms a coating in the nostrils. You can even apply sesame oil, so that prevents infection from coming into the nasal passages.
Okay. So okay, great. There is a question from Archana Sethi. Are people who are on psychotic drugs for schizophrenia more prone to the virus?
Uh, yes, and no as well. So, because uh, if they are well controlled, they will take all the hygienic precautions and all. But if their medication and all is not uh, being properly done, and if their emotional status is not in equilibrium, they will be little lax on the hygiene standards, and they are more likely to contract COVID-19. And that's why I would say that such people should be in touch with their psychiatrist from time to time, because especially in this time, the psychiatrists will be monitoring their status, adjusting the dose of the medicines. So this is I mean, both sides of the question are there.
In fact, another member has also asked about the psychological fear, how to get over it. Like, for example, when somebody is in the elevator, and if there is another person who's there inside the elevator, gone are the days you feel like there is somebody, you feel nice, or you feel like saying hi to somebody in the elevator. You, in fact, don't want them inside the elevator. So, how to get over this psychological fear?
I think, I would say that if you are taking all the precautions which have been laid down, there's nothing to fear. So all the precautions have to be done together. It's not one face mask all alone. Uh, if you're wearing a face mask, if you're not touching the lift buttons, and if you are maintaining a distance of 6 feet, you're fine. You can talk to the person. There's nothing stopping you from talking to the other person. But I mean, don't let fear hamper your. So it is about physical distancing, not social distancing.
Yes, true. Nisha asks, should we take vitamin C and zinc supplements? I think you've answered this question, but I
But people tend to overdo the vitamin C. 500 milligram per day is fine. When you take more than 1000 milligram per day, it impairs your copper absorption. So maybe just 500. Zinc, 15 milligram per day. That should be fine. If at all you have to take it.
So, doctor, coming back to a promise that you made to us initially, and we've still not heard on that. So, uh, so let me ask you again. So, when is the vaccine going to come out, and will our life come back to the old, real, normal?
So day before yesterday, the WHO chief, Dr. Tedros, made an announcement saying that there are 100 candidates who are doing research on the vaccine front. And out of that, there are about 7, 8 candidates who are doing really good work and very fast on it. And in fact, across 40 countries, there are leaders who have pledged about 8 billion US dollars for vaccine development and research.
Mm.
So initially it was said that it will take about 12 to 18 months for the vaccine to come out, but no longer anymore. They say that the vaccine will come out sooner, much sooner. In fact, Oxford University is doing a research with about 7 centers across the globe. Out of that, one of the center is Serum Institute in Pune, and they have pretty much advanced their work. And the vaccine should, I mean, my guess is it should come out soon, maybe by September, October. And there are other centers also like Bharat Institute, which is tied up with Wisconsin. So there's a lot of work going on. And very soon the vaccine should be out. However, having said that, uh, we should uh, not be, of course, the vaccine will come, people will get vaccinated, will get protected. But then this has to be the new world order of the day, that we have to take all these hygiene precautions. Uh, so these are just 5 or 6 precautions which you have to take. That's all. It's not big effort. It's five. It takes time, I know, but then as long as you are taking these 4, 5, 6 precautions, you're fine. You're safe. So don't unnecessarily worry too much about it, as long as you are doing the right things.
Yeah, the truth is, I mean, on one side of it, COVID-19 is brutal and we want to get rid of it. But it's also shown us many things that we need to relook at closely, and has taught us a few good things that probably we should carry on with us even post.
Yes, yeah, it has helped to control other communicable diseases. But then at the same time, our focus should not be totally on COVID, because there are other non-COVID patients who get ignored. So my um, request is that don't let elders or others ignore their illness because of the fear of going to the hospital. I mean, I have had so many of my patients who don't want to, they had pneumonia, they had a mini stroke, and they didn't want to go to the hospital. So,
Yeah,
so that fear, so we have to get over that fear. We have to start practicing scientifically.
true, true, true. Thank you for all the useful information you shared with us, Doctor.
Most welcome. Thank you. And thank you everybody for joining in. Yeah.
Yeah, and this was informative and also comforting. And also, I think all of us, we have to remember that we have to go with science and,
Not by
not
fear.
get overwhelmed by fear and panic. So that is something that we have to remember. Thank you so much again for this
Thank you,
conversation.
Neela. Thank you for inviting me.